Hello everyone, I'm Kirti Agrawal and I welcome you all. And today I am going to start with one of the series of all the integrated topics. I thought that, as I told you in the previous video, that we have to integrate and study in order to make a better understanding for all the topics. So this time I'm going to start with neurology, and my first topic is neural tube defects. I'm going to go system wise, so there will be a big series of all the neurological disorders, and then other systems as well. So first topic is my neural tube defects. First, I'll for every topic I'm going to tell you what are the integrated subjects we have. So in this we have embryology, obstetrics, radiology, and pediatrics. Why do fetuses are seen to have neural tube defects? Is folic acid deficiency in mothers and maternal drugs if the mother takes like anticonvulsants, valproate and carbamazepine. Everyone, those who have studied might know that valproate is one of the drugs which is going to lead to neural tube defects with a very high number. Overweight, uncontrolled maternal diabetes are also one of the risks for having neural tube defects. Now I'm going to ask you one of the questions, that is why, if supposingly we cannot give valproate and carbamazepine as an anticonvulsant to the female, so which is the drug we give as an anticonvulsant in cases of pregnancy? So this is your question number one. And if a female had a neural tube defect fetus previously, so her chances of recent pregnancy having neural tube defect fetus will be two times. So it's a really high risk, and we need to protect these females. Why and how are these manifested? So first you need to understand the pathophysiology behind it, right? In embryology you would have studied that after fertilization we have two plates, that is your endoderm and ectoderm. In 2 weeks and in 3 weeks you will have three plates, that is your ectoderm, endoderm, and mesoderm and endoderm. These three, and then there will be gastrulation process. So, as you see that the ectoderm is the one that will be forming your neural tube. You can see in the image that there is a purple color one, that is neural plate, and the other yellow parts, that is going to form your neural crest cells. Now you can see notochord there. Now these two words are a little bit confusing, that is a neural tube or notochord, and both sound similar and forming the neural structures. So I'll tell you how you are going to differentiate. Notochord is the structure that is formed by the mesodermal part, while the neural tube will be formed by the ectoderm. And the fate for these two are also different. Like for a neural tube will be forming your central nervous system, that is your brain and the spinal cord, while the notochord is going to send the ectoderm signals for formation of neural tube. And this notochord will ultimately get degenerated, and it will be forming intervertebral disc between the vertebra. Now, you can also understand why we have neural crest cells. These neural crest cells are also going to form some neurological structures, as we can say, some ganglions, and your also some the adrenal medulla will be formed by neural crest cells. Now in the lower images you can see the day sequence, like day 18, day 20, 22, and 23, how these are going to be formed. Now as this tube is completely formed, you can see that the tube will be having two openings. One will be the rostral neuropore, and the other one will be the caudal neuropore. The rostral neuropore, that is your cranial part of the neuropore, that is going to close by 24 days, and the caudal will be closing by 26 days. Now if you see these things, the if the upper part is not going to get closed, then there will be herniation of all the spinal contents out, right? And if the caudal is not going to be there, then there will be herniation from down part. Now we are going to study it as we go forward. Now neural tube defect, in the first picture you can see that if the cranial is not going to get closed, then we can have anencephaly. And if the middle part is not going to get closed and it is exposed, it can lead to craniorachiasis and encephalocele, while the caudal part is going to form spina bifida. Now in the second image you can see I have divided it on the basis of the location, right? You have to remember this location so that you can identify if you get some pictures on these, like your anencephaly. You can see your anencephaly, craniotracheosis, where both the part is not there, and encephalocele, open spina bifida and closed spina bifida. Now if you see such words like open and closed, it just simply means like open is the skin structures are not there and hence they are seen outside, while in closed the spinal cord structure, you can say the central nervous system structures are herniated but the skin has actually covered it, so it is closed. Now, how are you going to detect it? Especially in the time of pregnancy, you go with ultrasounds, right? First, that is your level 1 and level 2 ultrasounds. In level 1 ultrasound, that is your routine ultrasound, we usually go between 11 and 13 weeks, right? So you cannot see the structures very clearly, and some congenital malformations can be detected, but not very clearly. In TIFA scan, that is your target scan or level 2 scan from 18 to 22 weeks, this will be the best scan because it will going to tell you all the gross congenital anomalies. Now, how are you going to remember these 2 weeks and all things? It's so difficult to remember, right? So I just simply made one trick, that is level 1, 11. TIFA level 2, or you can say target scan 22, or you can say 20. So all sounds like TTT, and 1 is 11. Now if you want to tell me that how which one of these two are your screening test and diagnostic test, it's very simple, right? Level 1 will be your screening test and level 2 will be your diagnostic test. As level in level 1 you are not going to see very well, while in level 2 you are going to see it well. Now, your the second question goes to you like this: is which is the biochemical marker that we are going to use to detect congenital anomalies? First is you have to tell is first one is best or specific, or and the second one is a screening method. Now I am going to give you one hint. Both of these starts with letter A. So this is your second question. Next, we talk about anencephaly. Now, the word anencephaly will tell you that the cranial part, that the cranial neuropore fails to close, right? So, all the brain tissues are going to herniate out. Now, if these brain tissues are herniating, you can see it like a shower cap, like a structure, and hence it is named as a shower cap sign. The second is your Mickey Mouse sign, that is a triangular face that you can see even in the ultrasound image which I have shown you, and hence we call it as a Mickey Mouse sign. The other is your frog eye sign, that is the eyes are completely round and you can see that clearly, and hence we call it as a frog eye sign. Now as you understand that it is an open type of neural tube defect, and the brain tissues are going to get herniated out. Now these brain tissues are completely exposed to the amniotic fluid, right? And it is going to damage the brain tissues. So this fetus is not going to have any compatibility to life, so this fetus will come out as a dead fetus. Also in these fetuses, as the brain tissues and the neural control is not well, the mother can have polyhydramnios, as the fetus is not going to swallow the amniotic fluid complete. If you and there is two types of anencephaly. First is the complete type and one is the partial type. Now in complete we call it as holoanencephaly, while in partial we call it as a meroanencephaly. Holo is like completely all the tissue has gone out, while in partial there can be some tissues which are still present. Now, the third question to you is, till which week can we do medical termination of pregnancy in a neural tube defect fetus? This is going to be very logical answer if you understand it very well. Like I can give you one hint that these fetuses are not compatible to life. So what is the time you should, we according to the Indian system, which is the week till which week we can do medical termination of pregnancy? Next, encephalocele. Now, in encephalocele, there is a small defect. So, the herniation of brain tissues and meninges are still going to be there, but it is still covered by the scalp and the meninges and the skin. So, this is relatively going to be compatible to life, and hence we can do surgically and we can repair this seam. It is most commonly seen in the occipital bone. Now I am going to show, just see picture number 1. You can clearly see that if this is a brain tissue and this is the part which is getting herniated out, all the brain tissues are out, are seen out. In picture 2 it's not very clear, but you can still see some brain tissue which is going to come out. Hence we are calling it as encephalocele. The third one is your anencephaly. In anencephaly, what happens is there is a defect in the occipital bone. Now, if the occipital bone, if this is the occipital bone and the occipital bone is not formed, then all the cervical vertebra that is below the occipital bone will fuse together, and because of this the head of the fetus is going to be this, because the occiput is not there, and hence they are the head is not being supported well. In whenever you will do antenatal ultrasound, you will be seeing the fetus in a stargazer posture, or you can say a retroflexed position. This For this you need to understand the image very well, because there are in the exams these are the images which are which they can ask you. Now again, one more point to ponder is you have studied this word stargazer in one more place in obstetrics. We call it as a stargazer breech position. In this, what happens is breech, like the fetuses, the buttocks will be in this close to the cervical os, and the legs will be either flexed or it will be extended, and the head of the fetus is going to look upward, and like we are going to watch some stars in the sky, and hence we called it as a stargazer fetus or stargazer breech posture position. Now you can understand, like in this if you are going to in breech deliveries, it's very difficult to deliver the fetus by a normal vaginal delivery. We can either go with assisted or assisted vaginal delivery, right? Now the thing is, if the fetus's head is completely retroflexed, how are we going to deliver the head of the fetus, right? So in this pregnancies we usually go with cesarean section. Now, the next is your craniorachiasis. Cranio means cranium, rachie means your spinal region, and there is a splitting in both the cranium as well as the spinal region. In this image also you can see completely, like there is anencephaly as well as the spina bifida. All the tissues are out, and hence they will be exposed to the amniotic fluid, and the tissues are going to get completely damaged. The image for this craniorachiasis is really important. They can ask you for that. The next and the last topic for us is spina bifida. Now, spina bifida is of 3 types, and all the 3 we call as spina bifida. But to make it more specific, first is your spina bifida occulta, second is your meningeocele, and third is your meningomyelocele. In spina bifida occulta, you can see that there is underdeveloped posterior vertebral arch, and all the other things are intact. Now, as the other things are intact, but still they have a little bit chances that they may get herniate out. But if it's not, then this fetus will be asymptomatic, completely asymptomatic. But still there can be a little bit swelling, or there can be tuft of hairs over the defect. But it's not going to be as severe as the other defects. Now you can see in meningocele. In meningocele, it's the meninges which are getting herniated. Meninges are your arachnoid matter, dura mater, and your pia mater, and these structures can come out, and also the CSF can completely cover it. But thank God the nerve roots and your nerve are not going to herniate. Spinal structures are not going to get herniated. Now, as this is a seal, you can do transelimination test, and in transelimination test, what we do is we take a torch and we put on the seal or whatever swelling is there, and we cover it. If we see that the light is going to still pass through those, then we can understand that it is the fluid that is inside it. But if the light is not able to pass, then we see that it is a very solid structure, and hence the light is not passing. So for meningocele, the transelimination test will be positive, and hence we will be able to differentiate between all the 3. The third one is your meningomyelocele. You can say myelomeningocele, both are okay. Meningeo is your meninges, and myelo is the spinal cord structures which are going to herniate out. Now, spinal cord structures, especially if it is in the lower part of your vertebra, then there will be the nerve roots which are going to come out. Now, if these nerve roots are affected, especially in the lumbar region, these nerve roots are going to damage, and they may have a very high chances of getting damaged and also getting infected. And these nerve root, as they are going to supply the lower limbs, it can lead to flaccidity of the lower limb and also bowel and bladder incontinence. It's going to be a very severe form of caudal defect. All these are going to be a caudal defect. When is the caudal neuropore getting closed? 26 days. It gets closed at 26 days, and if it doesn't get closed, it can lead to the caudal neuropore defect. Now you can see that Arnold-Chiari malformations. There are two types, right? Type 1 and type 2. In type 1, it is the cerebellar tonsils which are going to get herniated out. But in type 2, the cerebellar vermis tonsils are also going to get herniate, and also the spinal cord are going to herniate. Spinal brainstem is also going to get herniated, like your medulla and all. And because of them, you know about the foramen magnum, right? If this is your brain stem, and this is your foramen magnum, and if all these get herniated down, this is going to foramen magnum is completely going to get closed, and it can lead to a lot of pressure. And as you know that in subarachnoid space we have CSF, right? Now this is going to completely get closed, and all the CSF is going to get accumulated, and it can also lead to non-communicating hydrocephalus. In case of hydrocephalus, you know that both your lateral ventricles are going to get expanded. Now, as you know about this defect, there is three major signs you are going to be asked about. You might have studied this in radiology or even in cases of obstetrics. First is your lemon sign. Lemon sign is because of the depression of the frontal bones, and hence we call it appears like the lemons, the upper part of the lemon, and hence we call it as a lemon sign. The second is your meningomyelocele, which we call as open spina bifida, and I have told you about open and closed ones, right? Meningomyelocele, in meningomyelocele, as these all the meninges as well your nerve roots are going to be out, we need to be very much cautious about it. Now the CSF is going to get leaked in this. So because of the CSF leak, there will be collapsing of the posterior fossa. The posterior fossa is going to be there. You know, the posterior fossa is like you have anterior fossa, middle fossa, and posterior fossa, which we study in cases of like the skull region, the lower part of the skull region, anterior, middle, and the posterior fossa. So in this posterior fossa, your cerebellum is there. Now you can understand that this is your cerebrum, and this is your cerebellum, and this is your tentorium cerebri, which is going to separate these two structures, and this is your cerebellum that is going to be seen in the posterior fossa. If the CSF is going to leak out, and there will be collapsing of the posterior fossa, and the cerebellum is going to completely wrap around the brainstem. What is the part of brainstem which is in front of cerebellum? Brainstem has three structures, right? The first is the midbrain, second is the pons, and the third is medulla. So if this is the pons, then this is the cerebellum. Pons and cerebellum. Okay. Now if this is not going to be if the CSF is there, CSF is not there, it has leaked out, and there is a collapsing of the posterior fossa, this cerebellum, this is my right hand, is going to cover around it, and it will form like a banana, and hence we call it as a banana sign. Now, in as you have studied all these, now you will tell me what is first is the anencephaly. What is anencephaly? The brain tissues have completely herniated out, and they have got damaged. While in craniorachiasis, the brain tissue, the anencephaly and spina bifida both is there. So as these two conditions are incompatible to life, we have to do medical termination of pregnancy. The next is your encephalocele. which is a small defect, so you can surgically repair it. Right now, the third one is your spina bifida. In spina bifida occulta, as I have already told you, that these are asymptomatic, and hence you don't have to do any management for it. But if it becomes symptomatic, then you can go with surgical repair. In meningocele and meningomyelocele, what you have to do, you can go with surgical management, and you can close that defect so that you can prevent complications like infection. But in case of meningomyelocele, as the nerve roots are also being herniated, there is a very high chance of nerves getting nerves getting defect. So we have to close this as soon as possible, like after 24 or 72 hours after the fetus has been delivered. Now, or as you know, all these defects are because of the folic acid deficiency in the female at the time of pregnancy. So we are going to give folic acid supplements. Now you can see the statistics also. Like if you give folic acid supplement, there will be a decrease in neural tube defect by 70%. And for this, we are going to give preconceptional supplements of folic acid, that is 1 month before the conception you have to give, and you have to continue 3 months after the conception. Now, what is the dose you have to give? You have to give about 400 microgram per day to the female. Now, this is given to all the pregnant women. But if she has already previously affected child who has neural tube defect, then you have to increase the dose, right? So from 400, you have to make it 4,000 micrograms per day. But please make sure this is 4,000 micrograms. And if you are asked in milligrams, then you have to say 4 milligrams per day. Okay. This will be 3 months before and 3 months after the time from the time she has conceived. Now, next question for you is how, if you have to treat folic acid deficiency in a female, what is the dose that you give? And the next question is patients who are on anti-epileptics, what is the folic acid supplement we are going to give to them before the conception and after the conception? Uh, Now these are all the questions which I have told you in the whole PPT. First is your anticonvulsant, which is the anticonvulsant that we use in pregnancy. Second is your biochemical marker, which is a biochemical marker. The first part of it is best or specific, and the second part is screening method, for using screening method. Now for both these, remember that I have told you that both these start with letter A. For the third question is, till which week can you do medical termination of pregnancy in cases of a neural tube defect fetus? The fourth question is, if you have to treat folic acid deficiency, then what is the folic acid dose that you give? And the sub part for that is, if the patient is having is on anti-epileptics, then to a pregnant female, then before conception and after conception, what is the folic acid dose? These are a lot of questions, but these are really very important. Please think and give answers. These questions are really very easy. Now you can answer it in the comment section. I hope you all like my video, and I thank you all for watching this video. Please do comment me and share in your views to me, like whatever, if you have any questions or queries about this related to this topic, or you need any help for studying. Also, I would like to, as I'm going to make a whole series for all the interconnected topics, and uh, all the interconnected topics, so I request you, if you feel that if there is some topic you feel like it needs to be integrated, please do comment so that I can make a video on those topics as well. Thank you so much, and for these questions I'll answer you after you have given me at least 4-5 comments for all the answers. Thank you so much.